I think we can go ahead and get started as we're recording. We can certainly share. Want to be mindful of everyone's time.
Okay, thank you so much, and thank you, Pam, and thank you everyone for making the time today. This is really an exciting opportunity. As you all know, the Delaware Health Sciences Alliance hosts opportunities throughout the year to make sure that our medical and healthcare workforce in general follows the arc that we have created and facilitated through a variety of mechanisms, such as what you'll hear about coming up soon. So that really that arc starts in high school, when we try to facilitate students going to the best colleges in the area and get them good pre-medical advising. This is all done in partnership with the DIMER program of the state, which is under the Delaware Healthcare Commission. And so those who are exceptionally well prepared for college and they can go on to then medical school, then we make sure that they know about the DIMER program, which is a facilitated medical school admission program that gives preference to Delaware applicants to our affiliated medical schools, two of them in Philadelphia, Sidney Kimmel and PCOM. After that, of course, we make sure they get visibility for residencies through the branch campuses. And that's where all of you come in, especially as we are helping to recruit residents, junior and senior residents into careers in the workforce in Delaware, all careers, of course. And that's where the Delaware Day option comes in, where all of you have participated in the last 3 years to make sure your opportunities are matched with the best candidates, whether they're from Delaware or not. We just want them to come to work here. Of course, if they are from Delaware, if they are DIMER graduates that follow this arc, that is even more of a success. This year, we're incredibly excited that something that perhaps is the greatest innovation in terms of loan repayment has finally come to pass. As you all know, there are a variety of federally funded programs that help those who are in health profession shortage areas in Delaware. But we heard from many of you that your opportunities much of the time weren't located in those areas. And those opportunities were wonderful, but they were somewhat restrictive. So under Dr. Phan's leadership, several of us created a committee a few years ago with then Secretary of Health, Dr. Kara Walker, at the instruction of Governor Carney, to put together some thoughts around this that eventually became legislation that got signed by the governor last year. And now several members of the same group are now serving on an ad hoc committee under the Delaware Healthcare Commission, including Dr. Phan and myself and many others, to make sure we create the best program possible for our entering Delaware medical professionals. So I'd like to introduce to you Dr. Nancy Phan. She is a practicing obstetrician and gynecologist here in Delaware, affiliated with St. Francis Hospital. She is the chair of the Delaware Healthcare Commission. She's a wonderful colleague and friend, and she's one of the key architects behind this loan program. I'd like to invite Dr. Phan to give you a bit of background about this program and how it came to be. And then we'll open it up to your questions, and we thank you again for submitting them ahead of time. And Ms. Gardner is going to help moderate those questions, and hopefully between her and Dr. Phan and myself, we will get you some answers. So again, thank you everyone, and Dr. Phan, over to you.
Great, thank you. Sorry about that. And thank you, Dr. Khan. Thank you for those very kind words. So I do have a few slides. They're very, very simple background slides. And actually the last slide is going to be the link to the website. And I figured I would just walk you guys through the website, because I could tell from a lot of the questions is really just about the application and how we came up with guidelines for it and the qualifications. So hopefully if I am able to share my screen, we'll go ahead and get started. Here we go. Okay. So this is a logo for the Healthcare Provider Loan Repayment Program that is a state program. Like Dr. Khan says, it is not a federal program. But when we get to the website, you'll see that the application is one application linked, because when we were talking to when we're thinking of the application, we want to make sure to make it as simple as possible so people could see what kind of bucket they would fall into. So like Dr. Khan said, the way it started off, we had an advisory committee, and a lot of the people that are on the current advisory committee were on the original advisory committee. After the advisory committee, Representative Vance sponsored a bill, House Bill 48, with House Amendment 1 that was passed last session of 2021, and Governor Carney signed into legislation. Afterwards, we formalized under the Healthcare Commission, the Healthcare Provider Loan Repayment advisory committee that help go ahead and formulate the application process and the qualifications. These are the members of the advisory committee. Thank you. And essentially, like Dr. Khan said, he's on it, I'm on it as the chair of the Healthcare Commission. We try to have representation throughout the state in different organizations. That's why we have 3 at-large members that we invited on. Essentially, besides the actual advisory committee, we also had 2 subcommittees, which looked at what was defined within the legislation called a geographic area of need. And essentially, there were a couple of people on it from the actual advisory committee, as well as a couple of people like Nicole Moxley, who from other state organizations, looking at what would define a geographic area of need. The legislation specifically did not want to limit us to just HCPLRP areas that were defined by the federal government, because that is one of the constraints that we felt under the federal student loan repayment program that made it difficult for people to be able to apply and qualify for the loan. A survey was sent out to all the healthcare systems to really determine what was their definition of underserved areas. This was associated with their community needs assessment that they had going on at the time. They sent back their responses, and then that went into what we put into our weighted criteria as a geographic area of need. For those who are very familiar with the workforce challenges we have here in Delaware, almost every single area is really area of need now, you know, especially when we talk about primary care. It is not necessarily a HCPLRP definition, but it is determined by the healthcare system in the geographic areas. Then there was a weighted criteria subcommittee that actually looked at when under the federal program, and people are familiar with the federal program, they actually weight your application to see if you qualify, and if you qualify, how much you qualify for. So the weighted criteria we carried forward into the health care provider loan repayment program. Having said that, we recognize that this is a version 1.0. This is the first cohorts that we will be rolling it out. As we roll it out and you can get feedback from both employers as well as applicants, there might be changes to it, maybe not super big changes. I think that the basic fundamental foundations of it will stay the same. But, you know, if there are different areas that we feel that either we're not meeting, that there's a gap, or if there's an area that we thought was going to be a need and isn't, then therefore we will change the application according to that. There are things that are defined by legislative mandate that we cannot change unless there is another statute put in place. And when we get to the website, I can kind of talk a little bit more about that. So Pam did share this particular link on in the chat if you weren't able to see it. Let me just move that. So if you go on here, you can see that it first gives you the background about how it came into process. And then essentially, if you look at it, talk about a initial contract term of 2 years commitment. One of the legislative mandated requirements is that these are recent graduates within the last 6 months. However, that requirement will be waived for what we call cohort 1 and cohort 2. So essentially, if you're any of the healthcare providers that are eligible, when we get to the healthcare practitioner application, I can show you, but also these are the ones who are listed. If you received your degree in 2021, for example, in June of 2021, you can still apply for cohort 1 and cohort 2. As of cohort 3, which starts in October, all those applicants must have graduated in June of 2022. The specific areas, specialties that are defined by the legislation is on the right-hand side. Adult medicine is really internal medicine, family practice, including osteopathic general practice, pediatrics, psychiatry, or if you are a nurse practitioner in behavioral mental health, or a physician assistant who is working those particular focus areas, geriatrics, as well as women's health. So for example, if I was graduating in June of 2022, I could actually be eligible for a application. Oh, okay, the website is not showing on the screen. I am sorry, thank you. Let me see if I can't do that. It says I'm screen sharing. Let's see. Is it just the application that's showing on the screen?
Dr. Fan, it's your slide that says application with the link. It may have opened in a new screen that you're not sharing.
Okay. It did. How do I change that?
You may have to stop sharing and then reshare with the new screen.
Ah, good point. Okay, let's try again. All right. Here we go. Now, can you guys see it?
Yes.
Okay, thank you. So I was talking about the eligibility. So on the left-hand side are the degrees that are eligible, and on the right-hand side are the specialties. Essentially, they're all primary care specialties. And like I said, adult medicine really means internal medicine. Under who may apply. So one of the problems we've noticed with the federal student loan repayment program that it specifically only applies to very, very specific practice facilities. The healthcare provider loan repayment program is a little bit more expansive, so it can provide to healthcare systems, private practices, healthcare organizations, like federally qualified healthcare sites. They're not applying on behalf of their qualifying employees. They will need to fill out their part of the application regarding the qualifying applicant. And so when we talk about must accept Medicare and Medicaid participants, and that includes the actual private practices, as well as be working in the VIP program. Now, the VIP program is a collaboration between a medical society and the state. Now, if you don't currently participate in VIP, you can easily enroll any of your providers in VIP. Essentially, it is a program where people can get services at no cost through the providers that participate in the program. And the last line talks about grants to hospital site must be matched on a dollar-by-dollar basis. So it's not really a grant to the hospital site. Awardees to the applicants will be divided in 50% if the applicant is being employed by a healthcare system. So once again, the healthcare system is not applying on behalf of the employee. The employee applicant is filling out the application. The healthcare system will have to fill out their part. And then if there is an award granted, 50% of that is due from the healthcare system. It only applies to healthcare systems. It does not apply to private practices or federally qualified healthcare systems. Any questions about that just yet? Okay. If you guys already went on this, I'm going to go to the healthcare practitioner application for a minute. This is not just it's not only a downloadable file, but you can download it, you fill it out as the PDF, and you send it back as email to the Delaware Healthcare Commission, to us as we're running it. So once again, it talks about the actual practices, specialties. It talks about which loan you're actually applying for, because it is a combination application. So for example, if your applicant's like, I don't really know which one I qualify for, if they check unsure, that's fine. They will just need to answer every single question in the application, because there are certain required application qualifications for the student loan repayment program from the federal government, which is the SLRP, that do not apply to the HCPLRP. So if they answer every single question, doesn't mean that they automatically go to the SLRP. If they check off unsure, we will be aware of that and be able to say, okay, actually, you're best fit to go in the healthcare provider loan repayment program. They cannot apply for both. So the federal loan program is exclusive, meaning that you cannot have another loan repayment program in any other form if you qualify for the state student loan repayment program under the federal government. So therefore, same thing for the healthcare provider loan repayment program. You can't have both loan repayments going on at the same time. You can, the first applicant is a 2-year commitment. After that, when they talk about student loan repayment programs, they only have a 1-year commitment. And then when after your 2 years, if you're the applicant and say, I know I'm going to be in this job forever and ever and ever, the legislative mandate allows up to 4 years of a loan repayment program. So then you can sign up for another 2-year commitment. If you know, for example, if your applicant knows that, well, you know, my significant other next year will be graduating and going off to do a fellowship, and we're not sure exactly where we're going to be, they might do a 1-year commitment. We recognize that this does not necessarily coincide with all employment contracts, but that wasn't really the purpose of it. So, but we wanted to make sure that people did have some flexibility, because once you're in a contract with the state, if you leave that contract early, and this applies to both the state student loan repayment program and the healthcare provider loan repayment program. So for example, if I was an applicant and I applied for that first 2 years, and after my first year, I said, well, actually, I'm leaving. I'm not going to be staying. I will have to repay back that first year loan repayment that was paid for by the state. That will have to go back to the state. So we didn't want to bind people to a 4-year commitment for a contract, knowing that they will have a penalty of repayment if they leave early, if they break that contract early. But we want to make sure that they would be eligible for all 4 years if they knew that they were staying. And then this asks for regular information. The reason we talk about years residing in Delaware, because that is part of our weighted criteria. The reason we ask about number of clinical hours, because there is different prorated rates if you're part-time and not an FTE, as per confirmation by your employer. Obviously, we talk about the area specialty. When you talk about the actual applicants, the ones in blue are the healthcare loan providers. Repayment applicants, all of those plus everybody in black can apply for the student loan repayment program. So if you know you have somebody coming in who is a LCSW and they want to get a loan repayment, they should try to apply, and they will be able to qualify for the student loan repayment. But that is a federal program that has a lot more requirements than the state one does. Amy, I see you have questions. Did you want to do that now, or do you want to wait until I go through the whole application?
Can I ask the questions now?
Yeah, go ahead.
Okay, perfect. So, so to go back to the eligible specialty, so I'm assuming a med peds trained physician who's working in primary care would qualify. It's not just FMIM trained. It's
Correct.
It's a med ped working in primary care.
Yes.
Okay.
Yes.
Geriatrics, it would be like, you know, an IM with the fellowship or psych with the fellowship. Geriatrics, just correct. Okay.
Correct.
Our physicians don't necessarily work like in a primary care practice. I mean, they'd be working in an outpatient pediatric practice, outpatient psychiatry practice. I'm assuming that's okay, just as long as it's an ambulatory practice in that specialty.
Right. So it's an ambulatory practice, and we count all those specialties as primary care.
Gotcha. So just wanted to make sure with that.
Yep.
So each time a candidate, a physician takes this, it's a 2-year commitment each time.
So the first contract is a 2-year commitment. And this is one thing the applicants need to realize. They're making a contract with the state.
Correct.
And so the first contract is a 2-year commitment. They have the option of having another 1-year commitment or 2-year commitment.
Okay.
So for example, like I said, if you know, like after your first 2 years, you're like, I love it here, I'm going to stay here for at least 5 years, you might as well just do the other 2 years. But like I said, if you know that your situation might change, it might be a little bit fluid, to not get that penalty, you might want to only do the 1 year.
Okay. And for a healthcare system, we are matching, we pay for half of what they've been awarded. Is that correct? We're not paying
Correct.
that 50% on top of the whole amount. We are paying half of it.
Correct.
Okay.
So for example, physician, 100% of an awardee would be $50,000 per year.
Yep.
If we felt somebody met all the criteria and got the highest rating, then they would get $50,000, and $25,000 would be to the healthcare system.
Okay. All right then. Rolling accepting, is it rolling approving? You'll just be approving as you receive applications as well? I'm going to go ahead, right? So sorry.
No, that's okay. I think I want to go, is it on this page? It might be on the website page. Let me, hold on one second. Let me see if it's on the website page.
Okay.
Can you see the website page?
Yes. Yes.
Okay. So where it says cohort 1, So it says application deadline June 1st. So anybody who wants to apply for cohort 1 should have put in their application by tomorrow. However, the turnaround time is about 2 weeks. So it's rolling as in, like, if you don't make the June 1, you can make the August 1. But like, and then the turnaround time is based on, usually we're trying to make it 2 to 4 weeks so that we can get back to people as soon as possible.
Okay. Is there a limit to how many you're going to approve?
It's limited by the budget.
Okay.
We do not have an endless budget. We wish we did.
Okay. And what was your budget again, your total?
So it is so the state funding is 1 million, of which 150,000 were committed for infrastructure. So there's 850 there. Plus we received another $1 million as a non-obligatory grant from Highmark. And then the governor for this fiscal year 2023 has another $1 million in his budget for it.
Wow. Okay. Okay. I noticed it's a work requirement of 40 hours per week.
That's
40
for a full time.
Clinical hours, because our physicians work 36 clinical hours. It's a 40-hour full-time equivalent for us, but 36 clinical hours. Will that qualify?
Yes. Yes. It's what your definition of FTE is. Like,
Okay.
but like if you said our FTE is 25 hours, we might be like,
Okay.
they might not get a full one. They might get a prorated one.
Got it. Okay. Okay. I think I'm good so far.
Okay. Any other questions while we're on this particular page?
Yeah, hi, this is Larry Ward from Bay Health. I just have a question while you're there. So
Sure.
they must accept Medicare, Medicaid CHIP. They also must be in the VIP program?
Yes.
Okay, I have to, okay, I just need to see. I assume we are, but I don't know.
So like, does your whole, med staff need to be in the VIP program? No. The employee participant needs to be able to participate in the VIP program. So
Okay.
if you have surgeons who don't do the VIP program, doesn't disqualify the healthcare system. But your applicant, if they're doing pediatrics, primary care, OBGYN, we want them to be able to participate in the VIP program. That's once again, that's a state program, like I said, that provides services for free to people who are essentially no insured. And it also there's a large actual surgical component to it. For example, we do have surgeons who provide like free colonoscopies through it, or, small office procedures, or even outpatient procedures. So we just want to make sure that they're able to participate in that program.
Yeah, I think that's going to be, my guess is that's going to be something that trips up a lot of people. I know we had an issue. We could not do the federal program, even though we have a very generous charity policy at Bay Health. We use a third-party vendor that takes into account things like family size and other assets and things like that. And that meant that we were ineligible for the entire federal program.
Right, right.
Again, we have a very generous charity program. So I need to see, I'm not sure how we can apply the VIP program to single people or if we're already in it. But I could imagine that being a problem. So,
well, and so I was going to say, if you have a lot of questions about how something like that would work, we can talk offline with Ashella, who is the DHCC staff member, and Elizabeth Massa, who is our executive director.
Okay. Are there any other requirements for employers? I mean, along those lines, again, those are where we've been tripped up with other programs.
No, I think the ones that are listed here are the primary ones.
Okay.
These are the primary requirements for the healthcare system. If you want, I can show you the healthcare system application or the employer application.
But I mean, I guess we'll get there. We can go through this.
Okay, and then these are these are for the actual applicants. They're not eligible if they're trying to use the loan repayment for anything that's listed here, or obviously if they have a felony conviction. A lot of these are similar to what's in the federal program, and we kind of just rolled them over to the state program. But one of the biggest ones is like the competing contractual obligations for healthcare services, meaning that if you're working in, let's say you're working for a private telemedicine group, and that you're trying to put that into your full-time application. That's not one of the employers that we're talking about. So they would not be eligible to be able to use a loan if they're only working for like Teladoc, because that's not like a healthcare system or a prior practice or something like that here. And then when we were talking about the weighted criteria, this is the weighted criteria. So the six criteria or geographic locations in the body of the actual paragraph, the geographic location, and that is weighted according to the geographic needs. Underrepresentation in medical environment, and that's because we're trying to increase our representation of underrepresented minorities like Black and Brown. Number of years residing in Delaware, if they have an advanced degree from a Delaware affiliated medical school, and that's really talking about DIMER students. We're really trying to have DIMER students come back into the state, multilingual fluency, and continuing participation in the program. So for example, if you already had a 2-year contract and you're like, I'm applying for another 2 years, you pretty much get weighted heavier, and you're pretty much able to get another 2-year commitment from the program than if you're a first time applying in the same year, because you're not really competing against a new application, you're just a returning applicant. And then when we talk about, the reason we talk about the points, because it goes into your portion of funding. So once again, this is based on a full-time applicant. If you're talking about somebody who is like a 0.5 or 0.75, then it would be 60% of what we would give to somebody who's a 0.5 or 0.75. It's not 60% of a full-time FE. It'd be 60% of whatever is prorated on that. And even though it says match, that's what we talk about, the dollar-to-dollar match by the hospital. And this is the systems that it applies to. And then, yeah, I think that's really the rest of that information on the website. I'm looking to make sure that I didn't skip over too many things. So this is when we talked about the full-time commitment versus the part-time commitment. Now, I know it says 20 to 39 hours per week, but I can circle back with the healthcare system staff and make sure that if you guys can put in there, like, this is our FTE, that they understand that it's 36 clinical hours, but 40 hours, like you guys count that as a full-time commitment.
Okay. Is it on the employer to let you know if somebody leaves, or how do you
It is on the employer and the applicant. If someone is like I said, if someone applies for 2020, if they applied now and they got the grant, and then next year they got an award, and this time next year they're like, oh, we are actually leaving, both you and the applicant need to come and tell us that that person is breaking their contract, essentially. And so going back to the actual application, these are the languages that we put down. The race and ethnicity, once again, goes into that demographics about trying to have underrepresented minorities. These are the same ones that are in the federal program. This is really talking about if you were located in another area. And these, most of, not all these questions are really for the federal program. The ones that start from the top all the way down to educational disadvantage, those are really for the federal program. And then the rest of it is, their certification. If we go to, let me close this out. If we go to the employer application, so this is a lot of your demographic stuff. This is this is confirmation about, you know, what you consider your full-time. So if you check off full-time and you have down applications, weekly work hours as 36, if you see down there, they must provide at least 20 to 40 hours of service per week. But if you're checking off full-time, we understand that's full-time for you. If you check off like full-time and it's 20 hours, we might kind of look at that and come back and talk to you about that. Once again, this is some of it says specifically for the student loan repayment program, which is not this program, that's the federal program. And then the rest of it is pretty much when you write down geographic area of need. So for example, if you know under your community health needs assessment area, like your whatever area you are, you can go ahead and put that in. If you know you have a HCPLRP designation, you can go and put that in. And then once again, I'm sorry, yes?
Right. Are the areas that you decided, I mean, it sounded like basically the entire state under your definitions, but is that anywhere? It's challenging sometimes to find the HCPLRPs. I always have to like search around on the internet to end up getting it, but is there make that easier for us to find or have your definitions? I mean, you know, rather than having us go searching for it, it would be really helpful to have that, you know, it's a relatively small state to have that somewhere where we could refer to it.
Right. So I think right now, I mean, I can check with our rural health. That's who our division of rural health who actually has that information. You're right. It does change it, you know, because it's determined by the federal government. And I'm not sure exactly what areas are considered HCPLRP, but you don't have to be HCPLRP to apply. For example, if you're down in, you know, Tidal Health, you're considered a rural area. If you're, you know, down in BB, you know, you're considered a rural area. If you know what your community health needs assessment area is, you can put that in. It doesn't mean that if you're HCPLRP that disqualifies you. It pretty much says check all that apply. And the reason I said it really covers almost the whole area is because when we looked at the geographic areas of need and we talked about the scoring, almost every section of the state scored pretty significant as being a area of need. I don't know, is Dr. Khan still on?
No, he had to drop off.
Okay, only because he was on that particular subcommittee. But having said that, that was pretty much their conclusion. So that's why we didn't tie it to a HCPLRP ID number. So if you don't know it, that's okay. If you need to, if you want to know it, just so there's an email, you know, and you can email say, I think we have a HCPLRP ID, but I don't know what it is, and we can find that for you.
Great, thank you.
Dr. Finn, correct me if I'm wrong, but I believe Dr. Khan said that if it wasn't a federally qualified HCPLRP area, there may be like higher weighting for the application, but all areas in the state would be included as areas of need. Is that correct?
Correct. So the geographic area of need is, the scoring is same as the HCPLRP scoring. So if for HCPLRP scoring, like, you know, it goes from like 1 to 7, 7 to 13, anything above 13. And so when we actually looked at it, almost every single area was either 13 or 14. So that's why we're pretty sure almost every single area is an area need, but it might not actually qualify as a HCPLRP area, but that doesn't mean you have to be a HCPLRP area to actually apply.
What if you're like a suburban, like North Wilmington area? What if, you know, we've got practices up here. What do you think?
So for example, if the applicant's primary office is in 19808, that's, you know, it's a little bit of a higher end area code, then they just, on their weighted criteria, they just might not get like a 1 on it.
Gotcha.
Doesn't disqualify them. They just won't get a score on it.
Okay. So when we get to this section, we're not checking off rural, urban, like it doesn't really, it's a suburban or it's a what would you call that? I don't know what, do we have to fill this question
And
out or just leave it blank?
it would be the other.
Oh, okay, with that word and scored,
Yeah.
okay.
Yeah, so,
I didn't even see that,
because
okay.
your HPSA, you have an ID and a score, but the other is a completely separate category.
Got it. I'm sorry, I missed that. I missed that
No,
box. I'm
it's
looking at
okay.
that list.
Yep. And then you could, click on it in your, enter your text, like as in, primary office zip code is.
I really think if you have a sort of an FAQs, this is one where I think links to these or explanations of this, because as you can us, I think there's going to be a lot of confusion over this one, and people may not participate or think that they are ineligible when it may be. So.
Right. So, the tricky part is the legislation itself says in underserved areas, but it was very broad. We can't not put it in the application because so that was just, that's just legislatively mandated. Having said that, we were trying.
Putting it on paper narrows it potentially, but I do think somehow explaining that, I think I'm sure you guys can figure out the words. It just, it's a little confusing for me at least. So, yeah.
No. That's why we had a whole subcommittee on it, because this was one of the areas that we knew was kind of murky, but we wanted to be able to have as broad as an application pool as possible. Our goal really is not to exclude anybody. Our goal is really to be able to have people come and be able to use this and incentivize people to actually come and practice here. But like I said, we have to be able to have some sort of definition for that just based on the legislation. The other part of it is that it has to be an ambulatory and outpatient setting. So for example, your employee cannot be a hospitalist. They can't be, even if they're a family practice trained physician, if they're working in the ER, in the hospital, they do not qualify. If you have a pediatric hospitalist, they don't qualify unless they're primarily working in the clinical outpatient setting. They spend a day in the hospital as, a hospitalist. So just to tell you guys.
Yep. Warren, you've got a question?
Yeah.
I did, just trying to figure out how to get off mute. So sorry. Thank you. So just a clarification, with the one application process for both the healthcare provider and the student loan repayment programs, if somebody applies and they're technically eligible for both, I know they can't double dip, they have to choose one, but do they get to choose one? Does the application process choose for them? How does that work?
That's a really good question. We actually think that there's going to be very rare cases that people are going to be qualified for both, mainly because the student loan repayment program is very, very restrictive. But if they do, I think that's going to be a conversation between the Healthcare Commission and the applicant. Trying to help the applicant get the most loan repayment possible. And we would probably recommend the federal program because the federal program has a lot of money in it right now.
Okay,
but that's not their only choice.
Thank you. May I ask one other question? That was really helpful.
Yeah.
The other piece that caught my eye was the eligibility. So I believe it was U.S. citizenship, J-1 visa applicants, or authorization to work in the U.S. For the period of the loan. And that was the language that caught my eye, because every now and then there's a good handful of, I would say, H-1B applicants that visa applicants that Christiana brings on board. And H-1B is good for X number of years. So sometimes, in a lot of cases, we'll do a permanent residency sponsorship. And depending on when the individual joins us, they might be joining us at the last year of their H-1B sponsorship. So of course, we're going to apply for permanent residency if they qualify, so we can keep them with us in the US. But I guess that would just naturally bump them out of the HCPLRP and have to go automatically to the student loan repayment, because if they're only eligible to stay in the US for one last year, even though while we're still simultaneously processing their permanent residency until that was granted, they really only had 1 year left on paper. So it would auto populate to the federal one. Is that right?
Yes, it is correct, as in, because I think the federal program is a year renewal.
Right.
Yes,
Okay, so they could, and then if they got their permanent residency, then after 1 year at the federal, they could always try for the state one.
they can't, because they'll be more than 6 years out from their, I'm sorry, more than 6 months out from their graduation date.
Ah,
Thank you.
Hmm.
Thank you, thank you.
Mm-hmm.
Hmm.
And then, so once again, talking about and this is going to kind of like an underserved area, exactly who they're actually serving. This is the specialties. This whole part says specifically for SLRP. So for example, if you know your applicant would not qualify for a student loan repayment program under the federal program, you do not need to fill this out. However, if you feel like, well, actually they probably would, then you can fill this part out. If you actually have no idea, you just want to fill that part out, go ahead. So, and then this is your acknowledgement. I think, yeah, that's the rest of it.
I
The
have
last,
another question again.
sure, go ahead.
So I'm just thinking about, and this might just be minutia, but so let's say it is the geriatric, so that's fellowship training. So it would be 6 months from their fellowship, not their residency, whenever they finish the training for the job. Okay.
Correct.
Got it.
Yes.
Okay.
Yes, but for example, if they were OBGYN and they went off and did MFM, that doesn't qualify them.
Gotcha. Yeah.
Mhm.
Okay.
And then the part C is just the loan information and verification, and obviously that is on the applicant's part. So I know that today's the 31st, and the first cohort due date is June 1st, but that doesn't mean that, okay, I missed that date, I can't possibly apply. Anybody who graduated from June of 2021, pretty much until now, can apply until August 1st. And that's why it's that 6-week rolling interval. Anybody from June of 2022 who's graduating this month coming up until October, they can go ahead and apply for cohort 3. So for example, if you know you have somebody coming in August or September, you can email them and say, hey, look, we have this program, go ahead and apply for it, you actually qualify. Now, if you feel like you want to wait until they get here, they have until the next cohort's probably going to be in January of 2023, but that will roll everybody in who's graduated from June of 2022. So having said that, just because they might not have applied by October 1st does not mean that this qualifies them.
So if the deadline for that is January, and that puts them more than 6 months beyond, I'm just making sure, so they would still be eligible?
So if they graduated, because if they graduated June 30th, the residency, they have until the end of the year. So if the next cohort is going to be in January, they still get to apply.
Okay, so I mean, if they end up applying in the beginning of January, you're not going to say no?
Correct.
Okay.
So it's the month of January.
The month of January would be the last month that they'd be
Gotcha.
able to apply for if they graduated in June of 2022.
Okay.
And going forward, graduations generally, I mean, occasionally there's somebody that graduates in December or January, but what do you anticipate your cohorts are going to be going ahead in the future?
I think going forward, the cohorts will probably be like August, October, January. We're trying to make it quarterly, but because of that 6 month limitation from the legislation, right now, as I speak, that's what we're thinking. But obviously, like I said, this is just version 1.0. And we feel like we want to at least be able to capture the people from 2021 and everybody from 2022 who would qualify and wants to be able to do it.
Yeah, we do occasionally get off-cycle people do graduate in December, and then the next one is August. That would actually be outside their window. So.
I think though that I think we would we would be okay with that.
Okay, all right.
Yeah, like we in the Healthcare Commission would recognize that. Like if we're not going to offer something in May, that's on us.
Okay.
You know, if we decide to, if talking to you guys, if the feedback we get from you guys is, look, like we really want to be able to offer something for the people who are off cycle, and you know, March and April seems to be better, then we'll do that.
I heard they might have to sign employment agreements prior to applying. Is that true?
Well, the reason we talk about employment agreements prior to applying for this is because you guys have to verify that they're employed.
Okay, so that will be a requirement. Do they need to provide the signed agreement?
No, you
Okay.
guys are providing the verification that you guys are employing them. That's why the applicant, the employer applicant has all the things about what kind of services they're offering, where's their site, how many hours are they working.
Okay.
And I'm sorry, you said J1 visa is eligible, but H1B is or is not?
No, they are they're all eligible as long as it's for the term of the loan.
Right. Okay. All right.
And Dr. Finn, this might be nitpicky, but just for clarification, when it says requires graduation within 6 months of the application submission date, meaning if we hired somebody 8 months out, we would have to wait a little bit till we got closer to their start date to actually be able to submit for the application, submit the complete application.
So for example, if someone graduated, let's say they graduated in June and they started working for you in February.
Sure.
No, I don't think
And
that
you're
was the
trying to
question.
see, do they qualify for a March or April deadline? Let's say we end up doing the deadlines, you know, March, June, August, and October. Let's just say we do that. You know, technically they graduated, but they didn't have an employment contract, right, until then. So I think those are the kind of like, okay, let's look at the applicant, let's look at the employer, and you know, we also talked about a review committee. We haven't, it's not an automatic. It kind of gets triggered, for example, if we have 30 applicants and 25 of them are all 9.5s. Like we can't give 25 people $50,000 every year. So the review committee would be looking at that. Doesn't mean nobody gets anything. It just means that even though everybody got a 9.5, we're going to have to figure out how to make sure that everybody gets some money.
Okay. Okay. I mean,
Same
that
thing for something like that. If you have somebody who graduates in the end of June, but they didn't start working for you in February, and you want to apply, I would go ahead and apply. My answer to all that is go ahead and apply, and it triggers the process within our system.
But thank you. That actually gave a whole bunch of additional information that I didn't even think to ask for. So thank you for that. And may I just rephrase my question one more time?
Sure.
The language itself says requires graduation within 6 months of the application submission date. So if I hired somebody 8 months before their graduation, I should wait 2 months. Obviously, they're not starting working with me yet because they're still going through school or they haven't graduated. I should wait 2 months until that 6-month mark and then submit the application.
So if you say you hired somebody in February and if you hired them in October and they're graduating in June,
The following June. So they would have signed their employment agreement. They just have not finished their training, which is not uncommon
they can
for
apply
us.
whenever they should apply whenever they want. Those are not the people that you need to worry about. The people you need to worry about, the scenario I was saying.
The point is that they're
Okay.
starting work with you within 6 months. They're starting to get the
That's
loan
right.
repayment within
Correct.
6 months. That's
Correct.
the intent, right?
Okay.
Correct.
Got it.
Okay.
That's what I'm saying.
Thank you for clarification on the language. That was really helpful. Thank you.
Yeah, the concerning one would be the person who starts after that 6-month period.
Correct.
I do have an extreme question.
Sure.
So if we decide that we want to start, if we have second-year residents that want to commit to starting with us a year from then,
Okay.
and that would be too far out because that's like in a different budget cycle for you guys and everything.
It's a
So in
total.
Okay,
so
do we
the-
work? We wait?
So the way the language in the legislation is written is subject to the budgetary process. So Governor Carney and Representative Vance are very committed to this. So that's why, you know, we have money for 2022, we have money for 2023. Come 2024, it will depend on who's the governor and if we have a champion in the General Assembly. It's written in the legislation that if there is a, you know, healthcare provider loan repayment program, $4 million, it will get it. But it does say it's subject to the budgetary process. That's why we want to be able to give people at least a 2-year contract so they get at least 2 years of it.
Okay. So I would say if I have somebody that wants to sign like a year in advance, again, extreme example, they should probably put something in until at least within the budget year. I would say. Does that make sense?
You know, somebody's going to graduate in 2024, right? Yeah.
Yeah. Okay.
I have one last question. Thank you for your patience with all of us. This has been.
Oh, you're fine.
I mean, we needed this because we just need to talk it out. Who is communicating this or advertising this to the residents and fellows? How is this being shared with them?
That's a good question. We're hoping you guys will do some of that. So we do have a marketing. We have A, B, and C doing our marketing.
Oh, okay.
And so, you know, we're trying to get them in front of people. Now, I will tell you, there's been in the past, not with this particular program, getting in front of residents depends on the healthcare system. We can't just show up at a, you know, residency council meeting or, you know, and technically speaking, like the only information regarding any of the residents is from you guys, right? Like we can't get any of that information as open information. People who are being hired, people who are graduating. So if you guys have a better way of telling us of how to share it, like we have the website, we shared it with all our stakeholders, a lot of whom, you know, not just you guys, healthcare systems, but like the FQHCs, the freestanding clinics, like they do come to the Healthcare Commission, they're on our listserv, so they have that. But if there's a better way to do this, we would love to know about it.
Okay.
Do you have a video? I mean, like this, do you have a video that they can listen to, or do you have like Q&As planned or anything along those lines?
We don't. Like if you're talking about something like a like kind of a, when you say video, I assume like something like a 5-minute webinar or something.
Well, or a 20 or a 30-minute one. I mean, where you kind of go through this stuff. You know, I mean, residents, you know, it's hard to say, hey, join us at 3 o'clock on Thursday. You know, they work asynchronously. So if you have something on the website with you, or, you know, somebody presenting, it's different than reading the application, and may be something that you can refer them to, that I can refer them to, where they can hear this stuff from the source. You know, I mean, just a thought. Okay,
and would make it a little clearer, you feel, for them versus just looking at the application?
Yeah, especially when it's just focused on the applicant. You know, you're doing this for us, for the system or the practice, but I think for the applicant, I think it would help, you know, walk through the application with them. You know, what you need to ask your employer. Here's what you answer on the application, the difference between the SLRP, because it's confusing. The SLRP is state loan repayment program, but it's actually federal. You know, like explain that to them. I think that would help them. And again, I think I would just record it and make it asynchronous, and then I could just point them to it.
Okay.
I would just like to add for internal communications, and I'll just suggest this. I know Christiana Care has one. I assume all of the health systems do, but there's a graduate medical education counselor committee that all of the program directors meet regularly for the programs. And bringing awareness to the program directors might be a nice way to also push it out to the residents, at least from, you know, just an awareness perspective. So just some food for thought on that.
Right. As we know, you know, like some of the, you know, feedback that as physicians would give you is that obviously a lot of people stay in the area that they do the residency. So if you have people you're hiring from your own residency, obviously internally, that would be a great way to share it. But also there's plenty of people who get hired from outside the state. And so I agree that having something that would kind of explain that to them, because one thing we don't want people to feel like is if they get to a question, say, well, I can't, like, that doesn't apply to me. Oh, so I guess I won't apply. We don't want that. That's what we don't want. We don't want people to feel like they're excluded, because as you go through the weight, like even if they get like a 4, they still get 30% of a maximum funding as long as they're full time, you know, so it's not like they're getting nothing. And so I would like people to be able to get that message across. So I appreciate that. I will go ahead and circle back with our marketing people and the staff about both in like a simple FQHC, not FQHC, an FAQ, and then like a recorded video.
And Dr. Fan, just for the recorded video, rather than having one long video, it may be helpful to have, you know, like a 2 to 3 minute on the application, 2 to 3 minute on eligibility, 2 to 3 minute on the weight, and, you know, qualified areas. I'm just thinking, if I have a specific question about one area, am I going to maybe watch a 20 to 30 minute, or am I more inclined to find that sound bite? So
Right.
just food for thought.
Okay. Any other feedback? I'm gonna go ahead and stop sharing.
I'm gonna have to jump off.
Okay.
Okay.
Thank you, Amy.
Thank you, Amy, for joining.
Thank you, guys.
Does anybody else have any other feedback or questions for me? So if you do, Pam always knows how to get in touch with anybody in the Healthcare Commission, whether it's me, Ishala, or Elizabeth. So if there's something that she kind of feels like really she wants to, you know, send her away, she will. So, you know, or if she feels like there's something that you really need to talk to one of us about, she can, you know, send something to me and so that I can respond back to you guys. But I feel like even from our side, this has been very helpful. I hope you guys have found this very useful to you. And I'm hoping that we are able to, you know, really, you know, push this forward to, you know, physicians and midwives and nurse practitioners and physician assistants, because like I said, we know there's a workforce issue and we're really trying to, you know, correct that, at least do something to improve that. So.
Yeah, the only thing I would say, the limitation I see is the 2 limitations are the need to be in the VIP program. And then obviously if you're trying to recruit new people to the state. You know, the fact that they can't be new to the state with loans and get loan repayment, even though they're not recent graduates, is, I guess that was in the legislation. I'm not sure, but if it isn't in the legislation, I guess I'm not sure why we're limiting that only to new graduates. But again, I assume it's in the legislation. But
it's in the legislation because we're trying to avoid people who've been in practice for 10 years. From applying, because we know they're staying.
Well, right, but I understand that. I guess, you know, if I could rewrite the legislation, but it is, if you're new to Delaware, you know, I understand what you're saying, you know, but you'd have to be new to Delaware, because, you know, as somebody, you know, I was 20 years out and I still had 75,000 in loans until public service loan forgiveness helped me out. You know, if you're new to Delaware, it's still a, you know, a net positive, but I mean, it's a moot point because it's only within his first 6 months, but it would have sure helped if I could have done new to Delaware people, because I could have recruited a lot more people than just people fresh out of residency.
Right. And I understand what you're saying. You know, I definitely do. I think there are pros and cons to all of them.
Yeah.
But in the end, unfortunately, it is in the legislation.
Yeah, it's a moot point. It's not worth, but it's, yeah. But yeah, we can definitely do a lot with this though, even as is. So
good. I'm
okay.
glad.
Thank you so much. This has been helpful.
You're welcome. You guys have a good week. Take care.
Dr. Fan, thank you for your time.
Great.
Everyone else, thank you so much for joining us.
Bye-bye. Hope you feel better, Pam.
Thank you so much. Take care, everyone.
Thank you too. Bye.